Hello, fellow pole nerd. Welcome to the podcast. This is Science of Slink. I have a research background in cognitive behavioral and social science and also personal training. And also I'm a pole teacher online. My goal is really for us all to be able to take information and apply it to our pole lives in a way that makes us happier, healthier, and increases the longevity in our movement. So let's hop in. Welcome to this episode that I'm very excited about. I am joined by Dr. Melissa Koehl, and I know a couple of my students have actually mentioned this to you. I was talking with a hypermobility specialist, and Dr. Koehl is a doctor of physical therapy, but also a Pilates and fitness instructor who specializes in working with hypermobile students with chronic pain, which I know is a lot of folks in the pole space. I should say I have normal collagen as far as I know. I'm not hypermobile, I'm normal mobile, but I know a lot of pole dancers. A lot of y'all out there are hypermobile. So I think this will be hopefully a very valuable resource for you. So do you want to start?
Thanks so much. Yeah, thanks for having me, Rosie.
Of course. I was going to say, do you want to introduce yourself a little bit and maybe talk about your background? And then we'll get into...
Yeah. Sure. So I'm Melissa Koehl. I'm a physical therapist, Pilates instructor, like you just said. So I am a hypermobile human myself. I have hypermobile Ehlers-Danlos syndrome, which I didn't know that I had until actually a few years ago when I was 45, when I was first diagnosed.
Oh, wow.
Yeah. So I had been hypermobile my whole life, obviously. Like I knew that, and I was a gymnast, and I was the bendiest of the gymnasts. Like that was my thing. I did all of the, foot to head, all of the, like a lot of back bending type things, all of the flexibility things that we would do in gymnastics that a lot of people had to work at. Like I was like, I can already do this. Like this is those things came easily to me. So it was no surprise to me that I was hypermobile. And even going through PT school, when we'd learn how to test range of motion and joint mobility, it would always be like, whoa, oh my God. And then the instructors would be like, oh, don't worry, your patients are going to be like that. And you're like, okay, actually a lot more than you would think, so I just had this misconception that hypermobility and Ehlers-Danlos were two very different things, because we did learn about Ehlers-Danlos syndrome and connective tissue disorders in school. And mind you, this was a long time ago. Like I graduated PT school in 2001. So it's a long time ago. But I think it's a little better now, but I don't think it's still great. But it was one slide, EDS is connective tissue disorder. Most people would be dislocating their joints all the time. And that's about it. It's hereditary. And the most extreme presentation was the only thing that we were taught. So it didn't dawn on me as I moved through my life and I had random things, illnesses, injuries, etc., that just progressively got worse as I got older. It never in a million years dawned on me that I actually had EDS. I was hypermobile. I knew that. And I probably had a bunch of other stuff that was mystery illnesses that no one understood. And then I just had to figure it out myself. I had to do a bunch of research and find information until I finally put it together that I found the diagnostic criteria. And this took years because everyone was like, no, you don't have that. But it just really was a journey. Anyone who's gone through this will know hopefully it gets faster, but it can take a while to put it together and to find someone to diagnose you. So that's where I came to figure it out. I basically kind of figured it out myself, and then found who are the providers that live in this space and understand it, and then started talking to them. And then they're like, oh, I got a diagnosis. And then I finally got myself feeling well enough, because I almost had to quit being a physical therapist altogether. I was just so ill. But then I figured out what was going on and got help for the various things that happened related to hypermobility. And now I decided that I shifted my practice to focus only on helping other hypermobile humans like me.
Yeah. I think it might be helpful for you to talk about some of the signs and sort of unconnected, quote unquote, things that you're experiencing. Because I think that there's, I don't know, a really common misconception that hypermobility is just being double jointed, and that's all it is. Mm-hmm. That's all it affects is, the range of motion of, some of your specific joints. And I think there's been a lot of research done, in the last couple decades that's, extended our knowledge quite a bit, but it's the whole body. Do you want to talk about that a little bit?
Mm-hmm. Yeah. Oh, sure. So it is possible, just to be totally clear, you can be hypermobile and have no issues related to it whatsoever. But that's a thing for sure. And certain people are lucky enough to be in that situation where their joints are extra bendy in multiple areas, and it never causes them pain, and they're perfectly healthy and never struggle with a lot of things. However, there are a lot of people that have hypermobile joints that also have these other issues that are related to your connective tissues. And the most common co-conditions that we see are things related to the autonomic nervous system, which is dysautonomia. So malfunctioning of your autonomic nervous system or the automatic nervous system, things that control your heart rate, your blood pressure, those kind of nervous system things that go on in the background, and mast cell activation syndrome. So there is a very high overlap between hypermobility and those two in particular. That's commonly in the EDS hypermobility space called like the trifecta, because most of us that work in this population see this in almost everyone that we work with has some bit of these three things together. So mast cell activation has to do with your immune system. And how this is all connected, like on a cellular level, like why people who are hypermobile or have EDS or have connective tissue disorders have dysautonomia more often or have mast cell activation more often, that is we don't know clearly there's a lot of theories out there, but we really, honestly, it's like a lot of very educated guesses on what's going on about what we have, but we do see that as a trend for sure. And then we could take that trifecta and there's like a whole more commonly it'll be described as like a pentad or like more, because there's actually a lot more other things besides those. But if you start with that actually covers quite a lot of the symptoms that we see, like fatigue, dizziness, GI issues, things like that, heat intolerance, those like kind of like some of the key symptoms that you might see. Like when you're first starting to put the pieces together to be like, man, I am just like really fatigued all the time. Like that's a really common thing. Or you may be diagnosed with IBS because of GI issues that are they don't have another name. It's not Crohn's disease or it's not ulcerative colitis or something that has a clear diagnostic marker. So they give you this blanket term, IBS, which means something's wrong with your digestive system and we don't have a name for it medically. So those are kind of the big things that we see. And then there's like a lot more other ones too. It gets pretty complex.
And I don't actually know the answer to this, but something that may be relevant for pole dancers in particular, as I know the autonomic nervous system has a role to play in sweating, and how much you sweat is really important in pole for us in particular. Is that something that dysautonomia would affect?
It could, for sure, because sweating is an autonomic function, and trouble regulating your body temperature is something that commonly can happen with a dysfunction in your autonomic nervous system. So if you're getting hot, you should sweat at the appropriate amount to regulate your body temperature. But if your autonomic nervous system is not doing a great job at that, you could not sweat enough, and then you get overheated. You start feeling very unwell because you're overheating, or you sweat a lot more than the average person, which I would imagine in pole, that's like the bigger problem. Actually, yes. They both would be bad because like either you're not sweating enough and you're dizzy and you feel like you're going to fall off the pole and that's bad, or your hands are sweating and then that's an issue. And in fact, when they do autonomic testing, there is a group of tests that they can do to test your autonomic nervous system to see how well it's working. It's not a perfect test, doesn't test like every single function of your nervous system, but it's usually done in a battery of tests. If you were to go get tested for POTS, which is postural orthostatic tachycardia syndrome, which is kind of the most well-known, most common type of dysautonomia, where when you're upright, your heart rate goes up super, super high. And a bunch of other symptoms associated with it. But when they do testing for that, it's usually a tilt table test. You lay down on a table flat and they slowly tilt you upright and monitor all your vitals and see how you respond to just that change in position, orthostatic tolerance, and like what your vitals respond to. And when they do that, they also can do some other autonomic testing, including a Q-SART test, which involves testing your sweat. And I have not had this test done myself, so I do not know the exact procedure, how it is done, but I know that this is one part of the autonomic testing. They will look at your sweating function as a kind of as one little indicator of just overall how your autonomic nervous system is doing.
Ah, good to know.
Yeah.
Might be relevant
can be a thing.
Definitely.
It can be a thing.
And it's interesting you brought up POTS because something that I have been noticing, and actually I think there was a study that came out earlier this year, was that folks who have long COVID, a lot of them are being diagnosed for the first time with HEDS because of the sort of like overlap in symptoms, and potentially being hypermobile, having EDS may be associated with a higher risk of long COVID. I think the jury's still out on that. I'll put that citation in the show notes for folks who are interested. Yeah, I don't know if that's something you've run into in your practice at all.
Yeah, just the slight, I don't know if it's slight, we don't know exactly how more common it is. It does seem to be like anecdotally when you talk to people who work with hypermobile people, it does seem to be more common, the incidence of long COVID, and there seems to be some predisposition for it, for sure. But I really don't have the data to say anything above that. But it's in a way, it's terrible how many people are getting long COVID.
Yeah.
That's number one. But number two, the one silver lining of that is that it is giving a lot more attention to dysautonomia and POTS and these kind of conditions that people have been struggling with for a long time, where the medical community in general was taking it very not seriously at all and just blaming it on anxiety, and really became a big struggle for a lot of people to find providers that even would do a tilt table test or know what POTS is or that kind of thing. So from that perspective, it is the fact that there's just the volume of people that are now having this condition, it's forcing the medical community to understand it a little bit more. So that's one small positive sign. We're seeing more research, there's more research, there's more providers interested in it. So that's like one small positive, I suppose, of that situation.
Yeah. Unfortunate, but good that we are, allocating more money and time to research on these conditions.
Yeah, for sure.
Yeah. So we talked about sort of this selection cabal is the word that my brain was trying to give me. That's not how I would describe this. I think the sort of collection of body things, I guess, that occur together. But speaking or thinking of just the hypermobility part, because you mentioned it is possible to just be hypermobile and even it not be an issue, right? How does that affect movement, and how does it affect what? I don't know. I'm always really hesitant to say to make recommendations about what you should and shouldn't do, right? Don't fall on your head. Feel great about that. Yeah. You shouldn't do that. Yeah. I don't want to suggest, and I don't think you would do this, that if you have hypermobility, you should never X, except for falling on your head. I'm putting that in the never bucket. But sort of general guidelines, recommendations you'd have, general things to keep an eye on that folks who don't have a connective tissue disorder or hypermobility might not need to keep in mind.
Yeah, from a movement perspective, I'm totally with you. I'm not a hardcore, if you're hypermobile, you should never do X, Y, Z. With the one other exception I would maybe say to falling on your head, which obviously don't do that, is if someone was to come with me and say hey, my hypermobile kid is thinking about signing up for American football, I might be really strongly recommending against that. Something a very, a contact sport. But even then, if someone's we really love it, and I don't know, there's concussions and all sorts of other stuff with that. That's another one that I'm that's another thing. But other than that, there's, depending on your body, there's very much, it depends situation. Depending on your body, you can train that hypermobility to be more controlled and to be stronger and to be able to use that hypermobility in a way that is less likely to cause injury. I never use the word bulletproof because there's no such thing as actually bulletproof in your body. It looks good on social media, but that's not really a thing. But I think when you are an athlete that is a aesthetic athlete, like a pole dancer, an aerialist, a gymnast, where you are really leaning into that flexibility to be able to do these really extreme things, it is really important to do additional stability and strength training to cross train that, because if you're only going to those extreme end ranges and not balancing it with other strength, you can set yourself up where you are potentially causing more injuries. You really can, because you're going to an endpoint and putting more pressure on the joints without support, because they're going beyond their physiological range. It just is more stress on the joints. So at a certain point, if you're always going into over splits, the ligaments that support your hip joints, they can become stretched out more and stay that way and they don't go back. You can do that. Like, just like if you've ever had an ankle sprain, you stretch those ligaments and then that foot is more floppy. It doesn't go back. You have to then learn to strengthen all of the muscles around there to compensate it. So it like would be ideal to avoid that, like use your range and do it in a way that you have muscular control over it. So it's not just taking that passive soft tissue and just putting it on a long stretch for a long time where it permanently stretches out even more and you can't get it back. Because one thing I do see is like ex-athlete, ex-gymnasts, ex-dancers, they feel like feel pretty good while they're doing their sport because they're like using your strength and your control and all of that during it. But then something happens and you get sick or you leave that part of your life and you join the corporate world or whatever the case may be. And suddenly you have all this mobility that you might have even gained. And now you don't have the control and the time to dedicate to controlling and strengthening that hypermobile range. So like with great power comes great responsibility. Like to have that amount of mobility, it takes a concentrated effort to control it. So like, yeah, it's a very long-winded way to explain it. Like you have to do it smart, I guess, do it smart, cross-train, strength training for sure, off the pole strength training for sure, off of whatever your equipment is. Like that's so important.
100%. Yeah. Students, I'm not going to name anybody in particular, but you know who you are. Listen to Dr. Koehl. Yeah.
It feels so good. It feels really good. I mean, I don't know if you notice this too, and you're hypermobile versus not but like the hypermobile people, I guarantee are the ones in your class that like love to stretch them up. They're like, can we do more stretch? Let's do more stretch. Whereas the stiffer people are like, oh my, okay, they're like have to force themselves to do it. They're like, I know I have to do this because I want to get my splits or I want to whatever. And they're like, I'll stretch. Where your hypermobile people are like, oh, I can't wait to get in there and do my splits and like stretch. There's something about that that feels really good. I don't know if it has to do with proprioception. Like we get some input, like finally we don't know where we're at in space and finally gets to that endpoint. And you're like, oh, there I am. And you're like, that feels good. It's like a neurological thing that feels nice. So it's like, it's very tempting to just like dive head into that and be like, that feels good. I should do what feels good.
Yeah. Plus you get especially like you mentioned in aesthetic sports, you get the, respect of your peers and audience. They're like, that's so cool. You can go so far. And I think that, that sort of positive social pressure can be good, right? Like, I think that's part of the reason why there's so many hypermobile dancers is that like, it feels really good to like, have something that's easy and get positive attention for it. Something I think about a lot, especially for hypermobile folks, is like thinking about like handstand training, right? If I straighten my arms all the way, they are straight, right? They're parallel to each other and my bones are stacked. And that's a nice, I shouldn't say restful, but it's an easier position to hold because I just have to like stabilize that stack rather than sort of like, if I'm doing something with my hands bent, my arms bent, rather that's like a lot of work with the biceps, that's a lot of stabilization. For hypermobile folks, if you go to the end of your range of motion, sort of definitionally, that's not straight anymore. So then it's more brain work. It's more like mentally fatiguing to be like, oh, I have to come to like an arbitrary point in the middle of my range of motion to get the alignment that's going to let me, hold a handstand for 2 minutes or whatever it is that you're working on. And I think that in my experience, that can also be really challenging for folks. You mentioned proprioception, which I know that, especially thinking about, a lot of neurodivergence is associated with greater rates of hypermobility, also associated with, worse proprioception, worse interoception. And also then, so you already have like the skill that you're trying to build, that sense that you're trying to build and do that, perceptual learning with, which is hard. That shit's hard. And also you're doing the like mind control, being like, okay, I have to have this like specific position that for everyone else, it's not a lot of brain work. It's still like muscle work, but it's not a lot of brain work. And I have the brain work on top of the muscle work. And it's a challenge. It's hard.
Yeah, it is very hard. And that's where things like any external cues that you can give, super, super helpful. Anything, like I know like in pole, you guys wear like barely anything at all on the pole. But like, let's say you're training and you're like the elbow is a perfect example. If you have an elbow sleeve, an elbow compression, or maybe KT tape or something like it's not actually holding your joint, but it's just something sensory into your nervous system to give your brain more information. It's like struggling to feel the joint receptors that tell you about proprioception, but it's like, well, at least I can feel the skin and I get a little pull on the fascia or a little bit of compression, something that helps it feel a little more aware of where you're at. That can be super helpful. Any kind of compression, leggings, compression on your arm, like any kind of anything tactile you can give yourself. Adding resistance to the thing that you're doing helps a ton. It seems counterintuitive because you're like, oh, protect the joints, but like adding a resistance band to like you can get super creative, but adding resistance to whatever limb thing that you're doing instead of your arm flopping around or your leg flopping around in space, having something to push against, even if it's light, gives you more information, or holding a little bit of weight or pushing against a wall, like any, those little tricks seem simple, but they actually make a huge difference, at least in that moment. Like, okay, take it off, and then you're still like, where am I? But still, at least you can compensate with those kind of things, those kind of tricks.
Yeah. Do you have any? So one thing that I've sort of been investigating more recently is sort of the neuro performance work, and one thing that has been suggested as a way to improve proprioception is like sensory input, but things like touching the specific muscle you're trying to find, or I guess if you're thinking about feet, it's like the acupressure sandals. They're so uncomfortable. I don't like them, right? Where you just get like a lot of sensory information from your feet. Have you found that is that something you've tried with more hypermobile movers, and have you had success with it?
Oh yeah, 100%. So it's actually kind of wild how it can work. Like you can give direct input to your nervous system about like that very specific area, either with like light touch, or skin stimulation works really well, just like lightly rubbing the skin over the joint that you're trying to understand, or the nearby spinal segments. If you think of neurologically, like where the nerve roots exit from your spine. So if it's upper body, anywhere in my arm, I might skin stim over my neck to help. It's there's no reason, no one's done a research study on this, no one, but you can try it. It takes 15 or 30 seconds. Skin stim over your neck, over the muscle you're trying to engage, or the area you're trying to get more awareness of it for 15, 20 seconds. Works fantastic. And then the way you can use external, like other peripheral parts of your body, it seems counterintuitive, but like your foot is a large real estate, like you mentioned, of space neurologically in your brain in terms of the amount of like physical space it takes up in the motor and the sensory cortex of your brain. Foot, hand, face, those are all very highly, richly integrated areas. So they take up a huge amount of space. So if we're trying to give your brain more information about where your whole body is in general, if you prioritize those dense areas, your brain generally will feel safer and have a better understanding of just where you are overall as a human. Just it generally feels safer, and it makes it easier for it to interpret other signals, easier for it to create a better motor output. So it's like sometimes you can do a foot stimulation on those, either like those sandals are nice. I like the rad neuroball. I mentioned it on my Instagram like all the time. They don't sponsor. I bought my own rad neuroball. I don't know them. Maybe I should meet them someday, but I love my little red. I step on it all the time. And it not only makes my foot feel good, but I can also notice sometimes like some tension in my neck feels better, and my shoulders feel a little bit better. And it's not because there's like a one nerve from my foot to my neck, but neurologically having more sensation, awareness where my foot feels more secure. My brain can kind of downregulate some of the tension it might have been holding on to, because it's like trying to hold myself together. It's like, okay, I know where my foot's at. I understand there's my base of support. I feel a little bit better. And it's really a nice option, especially if you're very sensitive. You have an area of your body, you're like, I'm trying to work on my neck. It's just so sensitive. You can do some stuff with the feet. And like, there's not, again, like not a ton of research in this area, but there is like a research study on people who had a cervical fusion in the past for neck injury. And the only intervention that they did was foot massage. I don't know the exact technique that they used, but they just looked at their pain levels and then a functional outcome measure, like a standardized functional outcome measure. Treatment was foot massage over X number of weeks. I don't remember exactly, but they had improved pain levels and the functional scores were better. So they did nothing with the neck whatsoever, just strictly foot massage. So there's some research to back that up. That's a real thing. So
yeah, I feel like in terms of things to try, like the the downsides if it doesn't work are like you spend 30 seconds patting yourself on the neck and nothing happens. Like the risk to
Right.
reward is pretty good.
Right. Exactly.
Yeah.
Exactly.
So I think that you've said something in there that made me go like, we should talk about misconceptions now. And I don't remember what it was, but segue, insert slightly better segue here. Yeah, let's talk about some common misconceptions about hypermobility. And I think one that I have run into a lot, especially with folks who are like newly diagnosed, they're like, oh, I had no idea I was hypermobile. I'm so stiff all the time. My muscles are always like, ugh, right? Like when I do flexibility training, it feels like such a big stretch and that like I'm constantly like sore and tight. And I think there's maybe sort of a general misconception that like, that doesn't happen if you're hypermobile and you're just sort of like loosey-goosey, beautiful ribbon floating on the wind.
I know, right? That's a huge one. Like you'll talk to people are like on the stiffer side and they're like, I wish I was flexible like you, because they're struggling with feeling stiff or whatever their issue is. Like, oh my God, if I was bendy like that, that must feel great. But in fact, a lot of times stiffness and feeling tight is one of the most common complaints I get from my patients, my clients. Like I feel it in my own body too. It's just like, oh, there's this tightness. And there's a lot of potential reasons as to where this might come from. Some of it has to do with your muscles just being fatigued because they're working so hard to hold you together. And like you have a muscle that's tired, it feels tight and sore. So the muscle gets a bit fatigued. Another thing that's super interesting, there's newer research coming out on fascia that is very fascinating because our understanding of fascia has changed so drastically over the last like couple of decades. We used to think it was just like this sausage casing. It was totally inert. Like in school, like we just dissected it away, like, and just, we didn't really talk about it much other than like plantar fasciitis. That's a thing, we talk about that. But otherwise, we didn't go into it too much. But now we know the fascia itself, it connects everything, all of your muscles, tendons, nerves, blood vessels, lymph vessels, this webbing throughout your whole body. And it's innervated, very, very richly innervated, has proprioceptive sensors in it. It has ability to contract and become actually tighter, which we didn't know that was possible because now we've like looked at it and actually studied it. There's cells called myofibrils and they don't contract as quick. You can't like say, hey, fascia, boom, like make a muscle, just move. It's very slow. The analogy, most of the research I've read on it is it's like a smooth muscle, like in your vessels, like where it slowly contracts and not quickly, but it does. And Tina Wang is a researcher that has done some really great studies on this, a couple of them so far. One of them is on the neck. And they looked at two groups of people, both with neck pain. One group was hypermobile and one was not. And so they went in, they wanted to look at the fascia of the two groups and see what the difference is. And with the assumption that the hypermobile group probably has connective tissue issue and that their fascia most likely would be like looser and, like we think of our connective tissue being looser. But when they went in and I don't know the exact mechanism, they didn't dissect, like they used some fancy ultrasound imaging, something super cool to look at all look at the actual connective tissue really in depth. And what they found was like around the SEM, which is like this main muscle right here on the side of the neck that turns and rotates your head, an area where a lot of people notice like, oh, I have so much tension there. That particular muscle in the hypermobile group, the fascia was thicker and tighter.
Interesting.
Than in the non-hypermobile group. So we still don't, again, the exact reason why, we'll flush it out, but a lot of theory being like, okay, well, if you're hypermobile and everything is moving so much, your muscles are going to be, your nervous system's going to recruit everything on board, your muscles, the first thing, but also we know that the fascia can contract, it's going to potentially, that's where it's tightening the fascia, it's trying to tighten everything, at least in the area where things are moving too much in general. So you get this like thickening in a way that probably isn't terribly helpful. Like maybe it's helping, well, it's probably helping you like not have your neck flop around as much, but it's so tight that it's painful and doesn't feel good. So there's a lot of, being tight and feeling tight, extremely, extremely common. In fact, and it also can get bad enough where it literally does restrict your range of motion and you do not appear to be as hypermobile as you would expect. So that gets tricky. That gets tricky like in a doctor's office where they only have a few minutes to examine you. They're just going to be like,
Yeah, I mean, it makes sense, right?
Yeah.
Because you've got a system with a lot of degrees of freedom. It's a little bit less, constrained than most people's. So, you've got a bunch of compensation, both muscularly, but also in the fascia. That's so interesting. And is that like a place where if it's negatively affecting you, would that be like manual therapy? Would mobility work help with that? Do we know much
Usually,
about that? Go ahead.
yeah. Like manual therapy for sure can be very helpful. Usually a less intense technique tends to be better for hypermobile people in general, but that's like very broad. Everyone's different. Some people love them, like give me an elbow, like scraping into my back and they're happy as a clam. But for hypermobility in general, there tends to be a little bit more often we see some sensitivity in the nervous system in general or the tissues, and like lighter, gentler techniques sometimes are better tolerated, but that can be one effective way. There's a few different styles of like that gentle technique. Some people aren't aware of it. Of just to mention some things to look out for. If you've tried like traditional massage and it just ends, you end up feeling like you have the flu or you feel worse when you're done. Like I've had that happen. It sucks because spent all this money. I was hoping to feel good, and now I feel worse. It's not fun. But if you're looking for a more gentle technique, there is like a myofascial release is one. That you want to find someone who's like been trained specifically that say, oh, I generally do that. You want to like have someone who's actually trained in the myofascial release technique. There's another technique that's newer called fascial counterstrain that I've heard wonderful, wonderful things. These are all very gentle techniques with the idea that you're applying very light pressure to get the nervous system to relax that tension that has been created in the fascia, right? Rather than like smushing it out. And even like things like craniosacral therapy is extremely, extremely gentle, but also it's the idea that you're working on the nervous system to get the nervous system to relax your muscles, and it's very gentle, light touch. And so those are like three types of practitioners, manual therapy that you might want to look into. We run into like issues with booking any massage, like any random massage.
Yeah.
So that might be something to consider. And then that's the other thing with manual therapy too, is like it's helpful, but it's not like it doesn't fix it. It doesn't treat the main problem. It's like a short-term relief. So you want to do the underlying stability work, strength work, awareness, to treat the main cause.
Yeah.
But it is helpful to have some sort of either manual from an external person or yourself. That's why I'm a big fan of doing self-release, because you have complete control over how much pressure you want. Well, you could just do one little muscle group at a time, whatever you want. So having some tools to release the tension can be really, really helpful, and then treat the underlying cause.
Yes.
Yeah.
For pole dancers specifically, if y'all are getting pain after you're dancing because you're doing hair stuff, please don't do a static stretch neck warm up. Please do a muscle activation warm up. I like to do like resistance with my hands. I've got a workshop if folks want to look it up, but please don't stretch out and then do a bunch of hair whips, especially if you're hypermobile. In my experience, you will regret it the next day, and I never want that.
That is good advice. I endorse that message. 100%.
Listen to the doctor.
Isometrics, yes, good.
Yeah. Oh, I love isometrics, especially like using the floor as resistance, because then you're building the proprioception. You're really developing a sense of like, here's where I am in space. I have like this outside haptic input that I'm like, oh yeah, that is where I am. I can notice if I start to peel up off the floor. And they scale really well with your strength. So if you're working at home and you don't have, the 80-pound dumbbells, whatever, I don't have 80-pound dumbbells, isometrics, you can still get really good strength gains with them. They're just hard mentally. They're just brain work.
Yeah.
Yeah, something you brought up, I was thinking about, and that was just, you mentioned a couple places, but like pain and the experience of pain. Because I know a lot of folks who have HEDS in particular also have chronic pain. And pain tolerance is something that I think about a lot. Because obviously, maybe that's not obvious. I don't know if it's obvious to you. Pole dancers, you all already know this. Full hurts. It is not pleasant. You got a gymnastics background. I mean, what steel bars are like. It's not great. But for folks who are coming in with hypermobility, maybe DS, maybe HEDS, how does that change your perception of pain? And what would you have folks keep in mind as they're doing things where like there is an expected amount of discomfort, but you should be able to notice that and not go past it?
Yeah, that's really interesting because I don't think we have any solid data on like pain perception with hypermobility being necessarily different. We do know that people who have hypermobility, they have more experiences of pain, but in terms of like if they experience it more intensely than the average person, that's a super interesting question because pain is like the pain neuroscience is totally fascinating, but it's so individual and it's so personal and it involves so many factors. Not just like what the amount of pressure is being put on your body at that one moment, but everything that's ever happened in your life ever, and all of your experiences and your thoughts and your emotions about it, and your previous trauma from you fell off your bike when you were a kid and you broke your arm and like your nervous system remembers that, or you had that one thing that someone was sitting next to you when your best friend said something to you in junior high that like just crushed you. And since then, the right side of your body, your brain remembers something about it. Like there's all of this is like kind of related and interplays into pain to some degree. So it's like really difficult to say like what pain should feel like. It's like, it feels like what it feels like. All your pain is real. Everyone's pain, whatever it feels like to you, that's what it feels like. And when it comes to like how to interpret those signals, like then that's also a bit complicated. So like in sports, especially something where you're pushing your body to the max, you're totally right. Like you're not going to be pain-free. There's going to be a certain level of discomfort that's like totally expected as you're training and doing hard things and things like that. So like a rule of thumb would be most people have a general sense of like what's a productive discomfort versus pain. Right. Like that's like one starting point. Like something that feels like I'm working, it's uncomfortable because I can tell I'm putting load through my tissues that it's maybe not familiar with, but it feels like I can handle it and it's going to be ultimately like a good thing. Your body's pretty, I'm not going to say good. I'm going to say it's pretty okay at feeling that versus something that's like, a intense, like this is bad, sharp, danger type of pain. So that's the first one that's like easier to interpret. The more subtle clues are a little bit harder, and being hypermobile and having perception that potentially is not so great, I tend to lean toward the side of being a little less like not pushing yourself quite so much because we just tend to not be as good at proprioception and interoception, just our understanding our body's signals. So because of that, when there's a gray area and you're not sure, especially if there's like pain and symptoms that come on after you're done and you have no idea, like you're like, what did I do? I don't know what. Like it's really it gets super, super muddy. But the best general approach to that is to just back off a little bit and do a little bit less. So then you can just be more critical. You can be more clinical about it after you're done. So it's like, okay, I did a little bit less. I gave a little bit less effort. I didn't push myself quite so much. How did that feel? And then build a little bit from there rather than constantly overdoing it where you're like, I don't know what I did. That something felt terrible afterwards. I might as well just do exactly that all over again and like, maybe it's better the second time because like then you also know, okay, I was sore because it was post workout soreness and I just felt a little bad, then it got better. But if it's like continuing to like happen over and over again, we have to just change what we're doing and it's like get a little clinical. That's where like, yeah, actually working with like if that's actually happening, that's where like working with someone to help you figure that out. It is really super helpful. It's really hard to figure it because it can be super tricky unless you are really, really skilled at knowing how to rehab your own body.
Yeah. I mean, even then, ideally, like as you start to notice something come up, my recommendation would be that's when you see a physical therapist so you can, identify if there's any movement patterns that are contributing. Yeah. And I mean, pole dancers, I know we all want to learn a lot of stuff as fast as possible. Something that may be helpful for you is if you have to take a long break because you injure yourself, if you look at like a year, you're going to be a lot less far along than if you take it down a couple notches every single training session.
Right.
And another thing I would really recommend is keep a journal of what you are working on specifically, particularly if you are doing your own training so that you can, start to put together those clues like, oh, every time I do splits, my hips hurt the next day. And like they might be a little bit sore. They should get better with movement. If they're not, see a physical therapist. That's an issue. There's something going on there.
Yeah. Getting things addressed early, 100% worth it. Like, I think a lot of us, especially if you're an athlete and you're used to feeling some discomfort, you're like, yeah, it'll get better. And you don't want to take the time to do that, but you will get it addressed so much. It's so much easier to treat things early. You may not need to stop, exactly, you may not need to stop training altogether. Maybe you just need to modify things just a little bit while you're addressing that thing rather than being like completely out of the count. And most people are going to just wait till it's like so bad that they can't do anything. So if you can, that's where it's nice. Like I have, my friends, family, people who know me, like they will like reach out to me like the second something happens because they'll be like, oh, okay, I can like literally, I don't even need to see you. You can explain what little thing happened. I can talk you through what to do. Like that is so much easier. But then you meet someone who's like, I've had this issue for 10 years and I'm like, I am not going to be able to fix this on the phone. Like we need to meet, we need to get like do this. It's so much more complicated that way, but smaller things definitely. Yeah.
Ounce of prevention.
Take care of it early.
Yes.
Yeah.
Especially because everybody wants to keep moving for as long as possible, right? Like we all want to be doing this in our 80s. So yeah. Don't ignore your check engine light.
Yes.
And speaking of working with a physical therapist, if folks wanted to work with you, because I know you see people online, and you also do conditioning and mobility classes specifically focused on the needs of hypermobile folks with chronic pain, how could they do that?
Well, thank you for asking. So I have a intro to movement course called Ground Control, which is designed for people who are brand new to figuring out that they are hypermobile and have not really been exercising or had to stop exercise altogether because they just really don't know where to start. And that's where a lot of people that come to me to work with me, that's like where they're coming from. They are like, I've tried, everything and nothing's, the PT I went to didn't understand hypermobility. The exercise class I took, it was beginner, but it was like way too much, it's like starting from the very, very basics and teaching pain management skills and bracing, taping, all of those things that you kind of need to know as a hypermobile person to get started. That's like my kind of foundational course there. If you're already like working out at a high level, you're pole dancing and you have this little things here or there, this course probably is not for you. But for higher level people, what I do have is I teach a combination of strength Pilates and yoga. I call it Chimera Fit, which is my business name is Chimera, which is a hybrid creature from Greek mythology. And so I started putting together all of these forms of movement for myself, for my hypermobile body way back in the day after I finished my gymnastics career, sadly, with a stress fracture to my back because I was doing so many bendy things without supporting my spine the right way. And now looking back, I'm like, I'm sure I could have had better training and had done all of that stuff better. But once I had to leave that aside, I started getting pain almost instantly. And I had to figure out how to exercise to feel as strong as I did as a gymnast. And it was really difficult to find exercise classes and things like that that really like suited me, that felt like it kind of checked all the boxes. And strength training on its own was obviously like, if I had to pick one of those three things, like strength training, that's like that's the desert island. Like you can't leave that. But then that on its own was missing some stuff. And I do Pilates and I was like, okay, Pilates is great, but it's missing some things. I do some yoga and I was like, yeah, but it's missing some things. And I like this, but I don't like this. And so I've put together my favorites of all of those things in one class. And I teach that at a couple different levels. Right now, who knows whenever someone's listening to this podcast, it's going to change. You can just check it out on my website, which ones I'm doing live. But I am about to release a library of literally hundreds of these classes at a few different levels, and intermediate and a higher, more advanced level. The advanced level being like basically what I do to keep myself fit, which is like a nice blend of all of those things, which I would feel like if you're a pole dancer and you're like, I want a class that I don't want to do my own, come up with my own workout. And I just want to listen to someone who understands hypermobility and gives good cues about it and has a little mix of all of those things. Like that's what those classes are. And I teach those live right now once a week on Thursdays. Cause like essentially it's like my workout. Like I purposely put it into my job so that I'm like, I have to be on Zoom at this time doing this thing because I need to do it. And if y'all want to join me, it's there. So I've got that. I also have an entire course on the non-joint muscle part of hypermobility called Navigating Healthcare as a Hypermobile Human. So that is all about the diagnostic process, dysautonomia, mast cell, chronic fatigue, GI issues, all of that aspect of hypermobility in one place. All of the things that I personally struggled with probably the most is like having my movement background and PT and stuff like that. Like I was able to rehab myself as stuff came up. So that was like not as big of it was an issue, but I was just like, I'm just bendy, I have to do extra stuff. But like when all that stuff hit the fan, I had no idea what any of that was. So this is like all of the things that I've put together. The most important things to make it as like digestible as possible, because it's very much like when you're first starting to think like, I think I might actually have EDS or hypermobility spectrum disorder. It's completely overwhelming. It feels like you're drinking from a fire hose. There's so much to understand. So I put it all together in one course. That's like an online evergreen. It's always available course that I have to help you with that aspect of things too. So let's see what else is there. I think that's it. I do see some people one-on-one. It's pretty long, my wait list for that right now, which is why I'm focusing on so much of the group and educational stuff as possible. But you never know, that could always change. So I technically have a wait list for that, but I have to caveat that as it's been actually quite a while since I've been able to add a new person to my list for one-on-one. So yeah.
Got it. So I'll put links to all of that in the description so y'all can check it out if you would like. And I want to be mindful of time. I'm going to wrap up the discussion here. I could definitely keep chatting. I hope everyone listening has found this very helpful. I'm sure those of y'all who are hypermobile are like, oh yes, taking notes. But even if you're not, right? I think there's no normal body that has, no issues at all, right? And I think it's helpful to think about, the ways that bodies are different and your experience might be different and how that might affect, the way you move, your interaction with movement, your experience on the pole. So I think it's still interesting and useful, even if, like me, you got that normal collagen. Just
Lucky
regular.
you.
I got other stuff going on, but yeah. But thank you so much for joining, Melissa. This has been really wonderful, and I've got all the information down there. So for those of y'all who are looking for more resources, definitely check this out.
All right. Thanks, Rosie. That was great.
Thanks so much for joining today. I hope this episode gave you a couple nuggets that you can take and apply to your own practice. And if you're interested in working with me, I teach online, so you can work with me from anywhere in the world. I teach flexibility classes, I teach strength classes, I teach pole tricks and technique, and my true love, freestyle flow, to really dive into developing your own authentic expression of movement on the pole. Those can all be found at slinkthroughstrength.com. I'll talk with y'all next time in the next episode, and I hope to slink with you soon.